Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. Welcome to Monday Health Minutes with Valley Health. Ear infections, ouch. They are common in kids, but adults can get them too. So we're talking with Dr. Thomas Young, our ENT at Valley Health here about that today, about the common causes of ear infections and what we can do age to age to try to diminish them as much as possible. Thanks for being here.
Thanks for having me.
Let's talk about the causes. Is there a difference between causes in kids and adults, and what are some of those causes?
Yeah, so I think when we talk about ear infections, the first thing we need to decide is where is the ear infection? And really talk about three parts of the ear. There's the ear canal, which goes up to the eardrum. Then there's a place beneath the eardrum where the middle ear bones are, and then there's your inner ear where your inner ear hair cells and nerves are. So if we have an ear infection in the ear canal, that's commonly known as like swimmer's ear. Mm-hmm. That can be very painful. You have swollen canal. You can't hear very well. And that's, of course, treated with ear drops and things like that. When we talk about infections of the ear with children, we're really talking about fluid and infection underneath the eardrum in the area where the middle ear bones are. And people that have an ear infection like that, they're going to have pain initially because that infection will form like a pressure pocket. Mm-hmm. Oftentimes it may rupture and you may have some drainage come out the ear. When that happens, actually you feel better because there's not that pressure or pain in there, but you will notice some drainage out the ear. And that's the most common thing that we see when we talk about children with ear infections. Now, adults can get that as well. Again, they'll have the same kind of symptoms, blocked up feeling in the ear, hearing loss, and then pain or pressure. When that happens, that's usually treated with antibiotics. But the hallmark of that is hearing loss and pain for that as well. Now, what causes that? Well, there's a natural tube that goes from the ear to the back of the throat that drains the ear. And if that tube isn't working properly, it's kind of like a kitchen sink. If the drain doesn't work, it backs up. You get fluid in the sink, and that's what happens. That fluid gets infected, and you get an ear infection.
When would surgery be an option? I know you've mentioned medications and different nasal sprays, but when is surgery an option?
The ear canal issue, usually never a problem. Usually with ear drops, we treat that like a swimmer's ear. But if fluid stays underneath the eardrum and it can't drain properly, we talk about putting tubes in the ears. And that's usually, the criteria for that are 3 episodes in 6 months or 5 in a year. And why do we worry about that? Well, because if that fluid is sitting in there for a long time, especially in children, they can't hear very well.
Yeah, and that's a big deal.
It is, because then we worry about speech development, speech delay, and we see that. So that also helps them get back on track in terms of hearing speech. But the other thing that it does is, and we've seen this in older folks that have gone through their childhood without tubes, is that infections can actually, if they sit there for a long time, they can actually erode the middle ear bones. They can cause a lot more problems with infections. You can develop things that are called like cholesteatomas, which are kind of dead skin that gets trapped in there. So the tubes are an ideal way to prevent a lot of problems in the future if you can do that. The other good news about most tubes is they will fall out on their own anywhere between 6 months and 2 years down the road. And so usually it's pretty self-limiting. As the child gets bigger, their face lengthens. That natural tube, instead of being more horizontal, tends to be more downward, works better. And so they usually outgrow those ear infections. But if we can get over that hump, they'll do a lot better.
When should someone consider seeing a specialist, not just past their pediatrician for those repeated ear infections?
Yeah, and I think that's where we go back to that criteria. You know, in a younger child that has a lot of ear infections where that fluid never clears, that's a good time to see that maybe tubes may be an option. The other issue is if, let's say, they have really bad complications with ear infections. You know, they have some children have seizures if their fevers get too high and things like that, or they've been treated with numerous antibiotics and they're not working anymore. So then you have to look at other alternatives.
Is there anything that people can do to prevent repeated ear infections?
Yeah, I think like for in adults, the usual cause for that is going to be allergies or something that causes their swelling in their nasal pharynx. So treatment of your allergies is going to be key, whether that's with nasal sprays or antihistamines, or there's some other medicines that work through different pathways. That kind of thing will kind of prevent it from happening so much. In other words, you can keep those natural drainage tubes open, you'll do a lot better. And then if that doesn't work, then we talk about allergy testing, which is another issue, another topic, but that works very well for folks as well if they have bad allergies. Again, if you can calm that whole system down, you do better.
Okay. Dr. Young, thank you so much. A lot to learn about infections for big people and little people. We sure appreciate it.
Well, thanks for having me.
Thank you. Thanks for checking in on Monday Health Minutes.